This is a classic anticoagulant rodenticide case. Let's work through the questions. Question 1. The rodenticide class is long-acting anticoagulant rodenticides, second generation, most likely brodifacoum or bromadiolone based on their market dominance in household bait stations. The mechanism: these compounds inhibit vitamin K epoxide reductase, the enzyme that recycles vitamin K to its active form after it's used in the carboxylation of coagulation factors 2, prothrombin 7, 9, and 10. Without active vitamin K, production of these clotting factors halts. As existing stores of those factors are depleted, which takes 2 to 5 days, coagulopathy develops. This explains the 3-day delay between exposure and clinical signs. The animal appeared fine for days because it was living off its existing clotting factor stores. Question 2. The platelet count is normal because anticoagulant rodenticides do not affect platelet production or function. Platelets are fine. This is a coagulation factor deficiency, not a platelet disorder. This distinction is clinically important. It rules out thrombocytopenia as the cause of bleeding and directs you toward factor deficiencies. If the platelet count were low, you'd be thinking about different differentials: DIC, immune-mediated thrombocythemia, etc. Question 3. Treatment plan. Acute phase. Fresh, frozen plasma to replace depleted coagulation factors immediately. This is the fastest way to address the active hemorrhage. Whole blood or packed RBCs if the anemia is severe and symptomatic, which it is here given pallor and elevated heart rate. Minimize handling and invasive procedures. Any puncture is a bleeding risk. Start vitamin K1 orally. Oral is preferred over sub-Q because sub-Q injection sites can develop large hematomas and IV has anaphylaxis risk. Discharge. Vitamin K1 for 4 to 6 weeks minimum for brodifacoum, bromadiolone exposures. Restrict activity. No rough play, no risk of trauma. Return immediately if any sign of bleeding. Recheck PT, PTT 2 days after the planned end of vitamin K treatment. If PT is still prolonged, continue K1 for another 1 to 2 weeks and recheck again. Do not stop K1 prematurely. Sum it up with 5 practical takeaways. Human medications are the leading threat in companion animals. Build the habit of asking about everything in the medicine cabinet. Rodenticide identification matters. The treatment for anticoagulants and bromethylene are completely different. If you don't know what they ate, gather all the packaging. Plants. Don't panic about poinsettia. Do panic about oleander and lilies. Anticoagulant toxicosis is manageable if you're thorough. Weeks of vitamin K and a confirmation PT before stopping. And in large animal practice, think at the population level. A single sick cow could indicate a feed or pasture problem affecting the entire herd. In our final talk, Talk 6, we're going to integrate everything into a systematic approach to the poisoned patient, from the phone call to the ward. See you there. If you like these toxicology videos, please subscribe and like. Liking communicates to YouTube to steer other students who need help here. Thanks for joining and see you next time.